Hi, everyone. It's nice to be with you today. It's actually a pleasure to be in the company of so many accomplished, passionate people who are dedicated to the things that I'm also dedicated to. On a light note, I would say that it's a really good thing that there's not a height requirement for living in a world of big things, because that's where I live. I live in a world at CMU of big problems, big ideas, big technological leaps, big solution creation, and big promise. As we all know, because we live in it every day, healthcare is the multi-trillion-dollar big monster of the global economy. And healthcare has a very complicated relationship with technology, embracing some innovative tools while also resisting others. Whether patients and their doctors are ready or not, many of us, people like me, are forcing new models into the system, ready to disrupt the status quo. I think we can all agree on a few things. We know that technology does make it easier to do things. It helps us perform complex procedures, give us better access to more effective solutions, helps us create novel drugs, new options, new devices, therapeutics, apps, tools. I'm describing where I live right now. And can already make a difference. We see those differences every day. And we know that this data-driven digital age that we all are living in makes gathering and using data just as important, if not more important, than all of those standard things that we've been doing thus far. Which leads to the where and the why of the work that I do. So the where, Carnegie Mellon University. CMU is always at the forefront on innovation. We pride ourselves on that. When you work at CMU, what you do is seek transformational impact on society through continual improvement and innovation in education, research, creativity, and entrepreneurship. CMU is a global research university. We have just under 1,500 faculty, 130 research centers, little less than 14,000 undergraduate and graduate students all over the world. We oftentimes get to be number one on a lot of lists: computer science, information technology, visual communications and multimedia and entertainment, engineering. And for schools of our size, we're number one in startups per dollar invested. We have our main campus in Pittsburgh, PA, which is where I live, Silicon Valley, and Qatar, believe it or not. So what makes us so unique to working on healthcare is what we don't have is a medical school. And I think that's part of the uniqueness of the model that I work in. So just a couple fun facts about CMU. Believe it or not, CMU was the inventor of the first emoticon, the smiley face. We invented Kevlar in an engineering lab when we were trying to solve a different problem. The first effective autonomous vehicle ever created and tested came out of Carnegie Mellon's Robotics Institute. Believe it or not, the pound symbol that you use, that's now the hashtag for grouping subjects on Twitter, was an idea of one of our faculty members to group people together when they were communicating. Google, Apple, Disney, and Amazon all have offices right on our campus. Just last week, I was at a press conference with Google where the president announced over $1 billion in social and community programs right out of Pittsburgh. And one of the things that we do at CMU is sort of wander around campus mumbling to ourselves, right? Asking the same question over and over and over again. We say to ourselves, WTF? And by that I mean, what's the future? So the why. I am the executive director at the Disruptive Health Technology Institute at Carnegie Mellon University. I'm leading a $20 million initiative there where we are disrupting the status quo. How are we doing that? We are working with the payer, in our case right now, Highmark, a Blue Cross Blue Shield provider, and a hospital system, along with innovators on the front side of technology development. So we don't invest in things hoping that something bubbles up on the bench that we can then find a vertical market for, or a niche, or an interesting application. We work by starting with the problems and then fish, if you will, and cast a net campus-wide, looking for the engineering expertise on campus in this neutral Switzerland-esque way, because as I said earlier, we're not encumbered by what I call the circle of sameness. We're not encumbered by what I call feeding our own monster. We don't have a medical school. So the perspective at CMU is very much a fresh perspective with every healthcare problem that we try to attack. Often in my institute, what we're trying to do is increase the affordability, the accessibility, and effectiveness of healthcare. Disruption in our case really just simply means a big technological leap in a shorter time to get it off the bench and into the system that it can help. By having the payer, the provider, and the innovator on the front side of technology development, we know that we are freeing the technology in some ways from later questions or later encumbrances that come when you're trying to push something through a new system. We take the best and brightest minds in all of those buzzwords that we all hear: artificial intelligence, behavioral economics, human-computer interaction, 3D printing, all of it. And we create the what's next in technological advances for healthcare applications. So let's talk about just 2 projects really quickly that will give you an idea of how we do things. I mean, who doesn't want to talk about inflammatory bowel disease? I mean, anybody here? I mean, it's my favorite. And I'm going to talk about colonoscopies next, which again, who doesn't want to talk about colonoscopies, right? So inflammatory bowel disease is actually a very serious problem. Together, the 2 main variants of IBD affect over almost 2 million Americans, with 70,000 new cases reported each year. Therapeutic options are very limited, and there's an urgent need for new therapies that are not prone to side effects. We have a researcher at CMU who said, I can do that. I can take some of the work I've been doing and apply that to healthcare. What she's doing is using bioactive raspberry extract, which is uniquely able, believe it or not, to reduce the permeability in your GI tract, which can lead to a very inexpensive therapy that lacks the side effects of conventional drugs. Colonoscopies. So we sat together and we said colon cancer is a very serious disease. Despite being one of the most preventable and curable diseases, cancers, there are 140,000 new cases a year, with 50,000 people dying in any given year. Colonoscopy-based early screenings literally cure cancer. The problem is that in any given colonoscopy, a clinician may see about half of your colon. What that means is that there's a chance to miss polyps. So we had a researcher who said, I've never worked in healthcare, but I've developed an algorithm that recognizes faces in a crowd. I can take that same math and I can apply that to the topography of the colon. I can help find polyps more quickly, and I can also solve one of the most serious problems that affect effective colonoscopies, is that when the camera is moving back and forth, there's a blurriness factor, which is part of what happens why you miss things. I can trick the camera by using math to see through that blur. So what we think is disruptive about these things is they're a shorter horizon to deployment because of the regulatory pathways, because we're not changing protocols, we're not changing equipment. So I sit in this university where lofty ideas are welcome, where entrepreneurship is the rule of the game. I think, though, after 20 years of being someone who's worked on the investment and funding of novel innovation, that there is some danger in that. And what I mean is, when we are disruptive transformation thought leaders, I think sometimes what can happen is we can get locked way up high in an ivory tower, looking down through the clouds from 30,000 feet, which in lots of ways makes it impossible to see the suffering on the ground. And we can't forget in healthcare our mission to alleviate suffering. Now, don't get me wrong, I'm all about disruption. You can ask any member of my family, and they will tell you, yeah, that's definitely something she's comfortable with. But I do think that we cannot drown out the patient's voice. We cannot drown out the fact that we have to get down on the ground and not just apply our what's next and our new shiny, glorious tech widget, but not forget about not lose the personal side of healthcare. No matter what, healthcare should be focused on preventing disease. No matter what, it's about making people well and empowering patients to advocate for themselves. I don't think we should downplay the art part of medicine, which is beyond learning an algorithm. It's the human connection to another person. And I know Peggy talked a little bit about this in her opening remarks. I am someone who totally believes in evidence-based medicine. I know it's critically important to patient outcomes. But I'm just suggesting that many times we should be looking more in depth by talking to patients rather than just simply putting a check mark next to predetermined questions for a history and a physical and a leading to a diagnosis. Perhaps the circle of sameness that we live in through protocols and living at this lofty idea of the what's next is creating medical mistakes. Perhaps it's helping us miss disease diagnosis or overlooking complexities in symptoms when someone's describing what ails them and why they don't feel well. There's research that led by Johns Hopkins researchers that tell us, as everyone has said today, that medical errors, in their opinion, rank only behind heart disease and cancer as the third leading cause of death in the United States. I'm going to spend just a very quick moment giving you an example of a story of a patient who suddenly just didn't feel well. Food wasn't attractive to this person anymore. They didn't want to lose weight, but they just didn't want to eat. So they went and sought out answers from a variety of sources about what could be wrong. It was determined that they had a fixable problem. It was a mental health problem, they said. And so this person worked very hard to eat and to want to eat and figure out the reasons why anxiety was creating this barrier to food. But this person actually didn't have an emotional problem. This person had a disease, a physical ailment that caused a full bowel blockage. This person was rushed by ambulance to the emergency room, where they were completely compartmentalized with no blood going to the bottom of their body. They were rushed into the OR for emergency surgery that in most cases could potentially not save their life. 7 surgeries later, 42 days in an ICU, this person died with an open belly. Why? Because they got trapped in an ideal instead of a physical fact of what they were facing. So what is my call to action today? Yes, I am a warrior of technology. It's what I've done for 20 years. And I think we should all keep being awesome innovators. I think we should keep doing exactly what we're doing with a simple added perspective. I think we need to readjust our perspective about how to be bigger, better, faster, stronger by adding kindness to that mix. Now, the word kindness is an Old English word with an original meaning that basically meant family or lineage or kin. Kindness, just in that sense, implies the recognition of being the same nature of someone else, in kinship together with other people. This implies that people would be motivated by that recognition to cooperate and treat others the same way, as members of the same family. And let's not forget what people said earlier today, that those of us that have been called to healthcare, most of us have been called to this field because we've gravitated there, because it's a calling to serve others. It's a calling to help people at one of the most vulnerable points in their lives. And we know we live in an increasing depersonalized world of electronic communication, emojis, lots of technological advances. What's going to work? What isn't going to work? What do we apply? What is just a lofty idea? With all of this movement through lots of depersonalization, kindness may seem unimportant. But in fact, kindness indeed is important to patients. Feeling the security, as Peggy said today, experiencing a sense of belonging and being heard and being cared for, is that these people aren't just an illness, but they're someone trying to figure out how to get well. A study conducted by one of the largest health systems in our country confirms that kindness matters. 87% of our fellow Americans feel that kind treatment by a physician is more important than any other key consideration when they're choosing who their healthcare provider is. Nearly 3/4 of those respondents said that they would be willing to pay more money to visit a provider who emphasized kindness in the way that they administered their treatment. Nearly 88% of those respondents said that they're willing to travel farther to receive kinder care. Can you imagine that you would fight a fight 42 days long alongside doctors and nurses and specialists and experts, and you would pass away and not even get a letter from the person that stood at the bedside for those 42 days helping to try to keep you alive? Not even get an acknowledgement to your family that they were sorry that after 42 days of fighting so hard, you didn't make it. Well, those letters don't come. So as I continue my impassioned work to create technology-driven solutions to really big healthcare problems, I'm committed to the belief that technology coupled with kindness will drive our future of healthcare. Let's be bigger than an acrimonious political healthcare debate that ultimately is no longer focused on what matters the most: how well our system is serving the millions of people that depend on all of us every day. Only by changing how we think about kindness at the bedside, about stepping into someone else's shoes when they're ill, about changing our facilities and our community and our policy making, can we deliver the world-class care that patients deserve and need, and create the earned trust and desired comfort for their families and loved ones as they fight alongside them. And so as I go back to one of the most brilliant technological ecosystems in the world, I fight to choose to solve problems with technology and with spreading kindness. And my call to action to all of you today is, in all of the work that you do, let's not forget that very important human connection. Thank you very much for your time. Have a good rest of the day.